Well, good morning, everyone, and welcome. I'm glad that so many of you could join us virtually on our Zoom for the St. Louis Regional Chamber's briefings on health and sports in the St. Louis region. As you know, COVID-19 continues to impact every economic sector, our businesses, our sports franchises, and as we know, our health. First of all, I'd like to thank all of our frontline healthcare workers for all they're doing for us and everything they're doing. They are just outstanding. I'm Tom Chulik, President and CEO of the St. Louis Regional Chamber, and I'm very excited that we have three tremendous speakers who will discuss the health impacts of COVID-19 and the effects on our sports community. So to begin our briefing, Dr. Catherine Satterwhite, Regional Health Administrator at the Department of Health and Human Resources, will discuss the health impacts of COVID-19 and her department's response to the pandemic. Following her health briefing, Frank Viverito, President of the St. Louis Sports Commission, and Kurt Hunzeker, former President of the St. Louis BattleHawks, will give an update on our regional sports. I'd like to thank them both for taking time to join our virtual meeting this morning and for their continued support of the St. Louis region. Now I'll pass the baton to Austin Walker, Vice President of Public Policy at the Regional Chamber. Austin?
Thank you, Tom, and thank you to everyone participating on the call, and especially to our 2020 public policy sponsors for supporting our program throughout the year. If you have a question you'd like answered by one of our speakers, please feel free to use the chat feature in Zoom, and we'll do our best to get to your questions. Dr. Catherine Satterwhite is the Regional Administrator for the United States Department of Health and Human Services. In her role, Dr. Satterwhite performs essential functions for the Department of Health and Human Services in three major areas: prevention, preparedness, and agency-wide coordination. Please welcome Dr. Catherine Satterwhite. The floor is yours, Doctor.
Thank you. Let me pull up my screen. And hopefully you should see it. So thank you so much for having me. Good morning. I'm going to start by actually starting at the very beginning to make sure that we're all on the same page. I think there's been a lot of information, so sometimes it helps to go back a little bit. So first, what is COVID-19? So it's an illness caused by a virus. It was first identified in Wuhan, China in December of 2019, which seems like a long time ago, but wasn't. It's spread mainly from person to person. So this means that, and primarily when you're in really close contact with one another, so within about 6 feet, which we'll talk a few times about. And that's, the virus is being spread through respiratory droplets that are projected into the air from coughs and sneezes. COVID-19 symptoms can include things like fever, cough, and shortness of breath. Been out there, but just in case you hadn't heard that before. And the incubation period for the virus that causes COVID-19 is 2 to 14 days, which is also why we hear a lot about 14 days and 2 weeks when we think about prevention. There is a group of people that we know are at higher risk for complications. So when they get sick, they might get even more sick, and it might even lead to death. Those include older adults and people with certain underlying medical conditions. So thinking about diagnosis and treatment, so again, it's caused by a virus, COVID-19, and we know that there are many labs that can test for this virus. That includes state public health labs, it includes county public health labs, it includes a lot of in-house hospital labs, such as some of the hospitals that are in St. Louis. It also includes a lot of commercial labs that have, and all of those labs have greatly expanded capacity over the last few weeks and are expanding on a daily basis. While we're working to expand testing, it's also important to remember that not everyone needs to be tested right now. Most people with COVID-19 have mild illness and are able to recover at home. However, there are some people who really can benefit a lot from testing. And if you're one of those people, or you work with somebody, or you know somebody who might fall into that category, please contact medical providers or the local health department who can help you work through whether testing might be a good option for you. As I mentioned, so COVID-19 is caused by a virus, and there is no treatment specifically approved. However, when people are in the hospital, so if you get to the point where you're so sick that you're in the hospital, hospitals and healthcare providers can provide what we call supportive care, help people relieve their symptoms and manage things like pneumonia and respiratory failure if those develop. However, that's not treating the virus, they're just addressing the symptoms. Because there's no treatment and we're in the middle of a pandemic, there are a lot of cases. So you can see that I pulled these numbers last night, and globally we're almost at 2.5 million cases. US almost at 750,000 with almost 40,000 deaths. And those cases and deaths are occurring across the whole world and across the whole United States, all 50 states and territories of the United States. More locally in Missouri, cases are approaching 6,000 with 177 deaths. As you all know, I'm certain that these numbers are outdated now because we're in a very rapidly changing environment. And in that changing environment, we've really had to focus on prevention. And that's one thing that all of the public health partners from the federal level all the way down to the local level have really focused on. So you probably heard this term flattening the curve. And one of the major strategies with flattening the curve has to do with social distancing, which can also be thought of as physical distancing. So keeping your body 6 feet or farther from another person's body. We've thought about a lot of different ways to visualize 6 feet. I've heard people saying, oh, it's about the length of a camel, which I personally don't encounter a lot of camels, but whatever works for you in trying to estimate that 6 feet, and 6 feet or more is what we're looking for. And importantly, they're both personal protective measures, such as the 6 feet distancing, and staying home when you're sick, which is a good health practice in general. We want to encourage people, not only now, but whenever they're sick, stay home, get better, focus on your own health getting better and protecting other people from exposure. We've also put a lot of community measures in place, postponing or canceling mass gatherings, which I know certainly impacts the sports community. Closing schools and encouraging telework. You can see from my camera that I am working at home, as I'm sure many of you are as well. So again, taking a step back, so you've heard the term flattening the curve, but I just want to make sure that everybody's aware of why we're doing that. So we put these protective measures into place because without the protective measures, so that's shown on the left in the curve in red, we were worried that we'd get so many cases that the healthcare system would be overwhelmed. And we've seen a little bit of that in other parts of the country like New York. So we put these protective measures in place, social distancing, closing schools, teleworking, to try to give the healthcare system a little bit of breathing room, both to build their capacity and to not overwhelm their capacity so that they can still provide quality care and give people the support that they need if they do need hospitalization. One of the things that the federal government has actually done to assist in this effort, flattening the curve and building healthcare capacity, has been to develop what we call alternative care sites. And there's actually one in St. Louis. It is in a former Quality Inn. And the idea behind building this alternative care sites is to help give another location for people, primarily people who have mild illness, who they may not need much hospitalization. They may need a little bit of medical care, or they might even just need a place to remain isolated from their family, from their loved ones. And so what these alternative care sites can do is provide care in a safe, comfortable setting. And it's amazing. The U.S. Army Corps of Engineers remodeled the hotel in St. Louis in 3 days to create 120 patient rooms and 4 nurses stations. So it's really an amazing example of a federal partnership that ties in with state and local efforts and really tries to bolster the whole healthcare community in those settings. And these have been happening across the country. So the last thing I want to talk about, I'm not going to spend too much time because I know there's a couple questions too, but is the Opening Up America guidelines. So I want to make sure that I cover these because I think they're really new and they're actually a good roadmap for how we sort of get back some of the things that we've had to sacrifice as we've had to enact some of these protective measures. So Opening Up America, again, is a phased approach, and it uses up-to-date data and locality readiness. And what we're trying to do with this plan is to mitigate the risk of resurgence. So try to figure out how we can keep a case volume down below that line where we would overwhelm our healthcare capacity. And especially we also want to make sure that we protect the most vulnerable, those groups of people that I mentioned earlier who might have a higher risk of complications, like older adults and people with underlying medical conditions. The other thing about these guidelines is they can be implemented statewide or on a county by county basis. It's flexible to allow for different approaches by different locality size. So the first thing you have to be able to do as a community, whatever locality we're looking at, is meet these, what we're calling gating criteria. So that means that there's been a sustained decline in cases for 14 days, which you'll remember is also the end of the incubation period. Also, the location needs to be able to test, so widespread laboratory testing capacity, and perform contact tracing. So contact tracing is what we do if somebody has a diagnosis of COVID-19. Public health professionals will go and talk to that person, figure out where they were, who they might have exposed, and they'll help reach out to those people who might have been exposed, then ask them to self-quarantine. What we do is we create a ring around the person who had COVID-19 to try to make sure that we can contain that case in a smaller group of people, which hopefully would then prevent us needing to take larger scale protective measures. And the final criteria item is robust hospital capacity, which has to do with the hospital's ability to take care of patients if we do start to get close to that capacity or even over that capacity. So the first phase, once those gating criteria are met, is phase 1. And what that would mean is we still would have to avoid gatherings of more than 10 people if physical distancing was not possible. So again, physical distancing and social distancing are used a little bit interchangeably, but keeping that 6-foot distance in mind. Phase 1 would also continue to encourage telework. Schools and camps would remain closed. Large venues can operate under strict physical distancing protocols, and elective outpatient surgeries could resume. So you can see here that phase 1 is just a little bit of a loosening of some of those protective measures that we put into place. And what you would do is you would see how it went. And if phase 1 ended up being okay, so there were really no case increases, and those gating criteria were still being met, we could enter into phase 2. So phase 2, we're going to expand it a little bit more. We're going to loosen a little bit further. So if physical distancing is not possible, we're going to avoid gatherings of greater than 50 people. So you're seeing a little bit of a more flexibility. Telework will continue to be encouraged. Schools and camps can reopen. Large venues can operate under moderate physical distancing protocols. And elective outpatient and inpatient surgeries can resume. That's those 2, and you can see that we're just slowly building. Phase 3 is a further building. Phase 3 is still not totally back to normal, but you can see that at each stage, there's more options as long as we do the prior phase well and evaluate the impact of the prior phase. When we do start leaving home, this is just a reminder, these are good health habits for all the time. Washing hands, don't touch your face. It's really hard to not touch your face. Cover your coughs and sneezes, not with your hands. Wear cloth face coverings in public settings. That's been a newer one. CDC recommended that not too long ago. And again, stay home if you're sick. So I want to leave you with that. I do want to give you these 4 resources. FEMA has a rumor control and a how to help webpage. If you guys aren't familiar with the US government COVID-19 website, it's listed here. And finally, I did not get a lot of chance to talk about mental health. I talked a lot about physical health, but remember that mental health is a very, very big concern right now too. So there are 2 resources provided here. One from SAMHSA, the Disaster Distress Helpline, and another from CDC, just at that thinking about managing stress and anxiety. So with that, I'll wrap up and I can take a few questions. I'm going to go ahead and stop my screen.
Thank you, Dr. Satterwhite. This is Austin. What is your medical opinion of the president's guidelines for opening up America? I think you mentioned that you thought they're good guidelines. How much input did folks like you have in the creation of the plan?
So there were a number of public health professionals involved. So the coronavirus task force that's out of the White House led this effort. And it was a very deliberate, thoughtful effort. And I think it's very well laid out. And I think it's feasible because there are clear criteria to move from one phase to the next. And it's a deliberate approach to make sure that we don't open up and have to take too drastic measures to go back.
Sure. And just another follow-up. So why doesn't everyone need to be tested?
So everyone, right now, the purpose of testing is to see we make decisions about the test result. So in this case, we'd be looking for, do we need to do that contact tracing around somebody to try to minimize the exposure? Everyone doesn't need to be tested because right now we're testing for the virus that causes COVID-19. I think there's a lot of questions about antibody testing, and I'm happy to address those if you would like me to. But that's sort of where we are. Right now we actually have to understand more about how antibody tests can be useful in understanding prior infection and what that means for future immunity. So those kind of tests, which I think is mainly what the public are interested in, aren't ready for widespread use yet. But scientists across the United States and across the country are really working to understand those tests better and hopefully provide additional guidance in the future.
Awesome, thank you. We've got a lot of interest in that, and the public, has been wondering when that might be available on a large scale, and also about what the latest might be on a potential vaccine treatment for COVID-19.
Yeah, do you want me to talk about vaccines for just a second?
Please do.
So I think probably you're aware vaccines take some time to develop. Dr. Fauci and a lot of other medical professionals have cautioned that it takes a year to a year and a half to really roll a vaccine out. So I wanted to just provide a little bit of updates. There are a number of vaccines under development in the United States and in other countries across the world. A few of these vaccines have progressed to what we call phase 1 human trials. During that stage of testing, these test vaccines are given to healthy adults to make sure they're safe and to see if the vaccine is able to generate an immune response in those healthy volunteers. But that's just phase 1. So before a vaccine would be available to the public, we'd actually want to look at it closer. So there's actually phase 2 and phase 3 trials that need to be conducted. And those trials look closer at vaccine safety even more because we really want to put something that's out there that's going to be safe. And we also want to put out there something that's going to work, something that's actually going to protect people from getting COVID-19.
So you're the administrator for Region 7. Can you talk a little bit about what Region 7 is and what that covers, and what role did Region 7 have in the phases of stimulus legislation that's already passed, and will Region 7 be providing insight for further phases?
So yes, I can answer part of that. I would have to defer, and so if there are questions I can't ask, I would also ask that you would send them to me and I can follow up to see who would be the best person to answer that question. But I can tell you Region 7 consists of Kansas, Missouri, Iowa, and Nebraska, so the heartland. And there's a lot of similarities in those 4 states, and it's been great to see the partnerships that have been developed in this response between those 4 states. So I'll have to follow up with you on some of the stimulus information later if you want to email that to me.
Sure, absolutely. So talking a little bit more about Region 7, has Region 7 benefited from being more rural than some places like New York City have, where they got high density population centers?
I don't know that benefit is the right word, but certainly we've seen that urban centers are hit first. And that has to do with population density. So when we talked about social distancing, more people in a smaller space just means the virus is spread more easily, which is why we saw urban centers really the first hotspots. So yes, we do have a lot of rural areas in Region 7, in all 4 states in Region 7. But we are seeing more rural cases now, so we'll just have to keep an eye on that as it rolls out.
Sure. And Doctor, we're going to have a couple of folks from the sports world on in a bit, and we're trying to, as a chamber, figure out, how we can restore consumer confidence when this thing actually starts back up, where people can go to events and be safe. And like, what does the future look like for big events? How can we protect ourselves?
Right. So from a big picture, I think that the COVID-19 response has really shown how partnerships between public health professionals, medical care professionals, elected officials, and the public can really make a huge difference. So those partnerships and actions on each of those stakeholders will need to continue to keep the public safe. And if we can continue to work together, we can move forward in those phases that are outlined in the guidelines for opening up America again. And so for big events, like sporting events, it's going to be a gradual process where we can get to that place where they're going to be safe. Because I know they play a huge role. They are something that everyone is missing. My son is very sad that the sports page is a little bit skimpier than it used to be. So the first step in making and getting back to that place is going to be continuing to work together and being patient as we come up with maybe some creative approaches to making those things open up in a different way than they used to be, at least initially.
Sure. So last question. Thank you so much for your time. Looking in your crystal ball, what does Region 7 in America look like in 1 month, 6 months, a year? Are we still wearing masks everywhere? Are we still hoarding hand sanitizer? What do you think that looks like?
That's like $1 million question, isn't it? And this is one thing that I have tried to do personally, try to live in the moment and plan for the future. I think that we all have learned to be very flexible and to be very nimble in trying to figure out what the next response is. I think we should all continue to be flexible. Right now, I think that data are showing, and federal scientists and scientists across the world, that it's probably not gone yet, that we may have to do some adjustment over the next time frame before we can get some treatment or some vaccines that we hope will be more protective and help us in the future. So my crystal ball is cloudy, but I think we just have to continue to work together and be patient.
Awesome. Dr. Satterwhite, thank you very much. Thank you for everything that you're doing in Region 7 for America, keeping us all safe. Really appreciate your insights and your leadership and your time today. Thanks for being with us.
My pleasure.
And now joining us is the president of the St. Louis Sports Commission, Frank Viverito. Frank became president of the Sports Commission in 1995. Throughout his tenure, he's played a key role in attracting high-profile sporting events to St. Louis, including the Final Four, the Frozen Four, the PGA Championship, and the Men's Olympic Gymnastics Trials. Frank's mission is to make St. Louis a better place to live, visit, work, and play through sports. Please welcome Mr. Frank Viverito. Frank, the floor is yours.
Great. It's a pleasure to be here. We're live in my basement, which was the kids' playroom back in the 1990s. But, I'm just awed by the work that Dr. Satterwhite does. And I want to add my thanks to not just the healthcare workers, but all the frontline workers for helping to keep our community safe and healthy. There's really no way that we can, repay what they are doing for all of us. But on the sports side, I think we see exaggerated importance and visibility in our community and in our society, that sports, for better or for worse, are front and center during this pandemic. Locally, nationally, and globally. And that was similar to what you saw also after 9/11, that sports are diversion, sports are community, sports are economics, sports are fun, sports bring us together, sports make us healthy. And so, you know, we look at this at the global level, but also at the very local level. And the St. Louis Sports Commission is actually a pair of affiliated, independent, privately funded nonprofit organizations. We have a staff of 9. We have a very large board, many members, many volunteers, many community partnerships that keep us viable and help us do what we do, which is to bring sporting events and programs for young people to our community to make St. Louis a better place to live, visit, work, and play through sports. We're funded through a combination of net revenue from the events that we produce, plus corporate and individual partnerships and memberships. Unfortunately, not eligible for the PPP program because even though we're nonprofits, we're not quite the right kind of nonprofit. We're a business nonprofit, but hopeful to have some relief in the second round. So when we take a look at this year, the Sports Commission in the first 6 months of 2020 had 15 events booked that we were ready to produce, and we lost 13 of those 15. We were able to get in the NHL All-Star Game, which was a wonderful moment for St. Louis, and hats off to the Blues and the NHL for that great memory, as well as the Missouri Valley Conference men's basketball tournament at Enterprise Center. But we lost the NCAA men's first and second round basketball at Enterprise Center. We lost 7 NCAA Division II and Division III championships that were going to be hosted with Lindenwood and with Wash U in golf, lacrosse, and tennis. We lost the 2020 United States Olympic Gymnastics Trials for men and women. That was a sold-out event at the Enterprise Center in June, and 3 more national gymnastics championships in trampoline and tumbling, rhythmic gymnastics, and acrobatic gymnastics, plus the National Gymnastics Congress and Trade Show at the Convention Center. And I don't even want to do the math on the economic impact of that lost business, but it's likely north of $30 million and counting. But, you know, we're not here to lament our losses. We're focused on bringing business back to our community and bringing new business to our community. And I'm excited to talk about the opportunities that we have at this point in time. One very recent success was to book an event for March of 2022, good short-term business with the American Collegiate Hockey Association. That's an event that'll take place at the Centene Community Ice Center in Maryland Heights. We'll bring 72 men's and women's college hockey club teams to St. Louis, more than 1,500 hockey athletes and 100 games, which will be a wonderful event for St. Louis County. We're very, very hopeful to be able to rebook the United States Olympic Gymnastics Trials, along with the additional gym championships for June of 2021, and an event that we're very much looking forward to in March of 2021 if the restrictions are eased and we can fill arenas to at least a certain degree, would be the NCAA Wrestling Championships, which will come back to St. Louis for the 9th time in 20 years. And I always ask groups that I'm speaking to, how many of you are college wrestling fans? And nobody raises their hand. But then I say, if I told you that during our 9 NCAA wrestling championships, college wrestling fans spent over $100 million in St. Louis, how many of you would be college wrestling fans? Everybody puts their hands up. So it's a wonderful event for our community, and hopefully a forerunner of many more NCAA championships to come. We have recently completed a bid process where St. Louis has bid for 50 NCAA championships between fall of 2022 and spring of 2026. We hope to hear back from the NCAA with their national decisions on championship hosts this year on October 13th. I also want to spend a couple of moments on one of the biggest event bid opportunities ever for St. Louis, perhaps our biggest, and that would be for the 2024 United States Olympic swimming trials. And it's amazing to think about the numbers related to that event. It would bring over 250,000 fans to St. Louis, and it would approach an economic impact of $100 million. You're probably thinking right now, where would we host the United States Olympic swimming trials in St. Louis to bring those kinds of numbers of people to town? And it would be at the Edward Jones Dome, the former Edward Jones Dome, the current dome at America Center, which would accommodate 2 Olympic-sized pools and up to 25,000 fans a day for a 10-day event that's nationally televised every evening, and would be a wonderful celebration of Olympic sports in our community, which is the host of the 1904 Olympic Games, America's first Olympic city. That's the event side of what we do and what we have to look forward to in a nutshell. On our foundation side and our youth side, we're very excited about our sportsmanship programs. And our number one sportsmanship program are the Musial Awards, which are now on national television. The live event has taken place for 14 years now at Stiefel Theater and other venues in the region. And we think that good sportsmanship is the best message for these times, not just as a way to promote St. Louis as a city of good sports, but we want to own sportsmanship nationally, and we want to promote a message of civility and respect and kindness that we believe has never been more important. I believe that that local and national brands will want to be associated with these messages of good sportsmanship as media, advertising, and events return. And we absolutely want St. Louis to be synonymous with good sportsmanship. This is STL made. This is who we are. And as we think about the value of a national television property that will air in December on CBS, whether or not there's a live event in November, I think this is probably the most valuable event product that any sports commission in the United States owns. Sportsmanship is, as I say, who we are, and it's what we do on a daily and weekly basis. We have school programs that are now online to teach kids what musial moments are and how to be good sports. And I actually have about $30,000 right now that's burning a hole in my pocket that our young professionals groups have raised. Our St. Louis Sports Commission associates raised this money to award to regional high school seniors this spring who have exhibited good sportsmanship during their athletic careers. The applications for our sportsmanship scholarship program are open till April 30th at stlsports.org. It's a great way for us to encourage good sportsmanship and to reward good sportsmanship. So again, we have the Carl Fricks Sportsmanship Scholarship applications online and open through April 30th. When I think just comparatively about cities, sports commissions, large events around the country, we're all pretty much in the same boat. Those cities who are heavy into crowd events and those sports commissions that are single source funded either through hotel taxes or government appropriation are oftentimes in an even more difficult position than we are because of our diversified sports impacts and our diversified sports events and our diversified sports funding. And I know that I'm kind of the lead-in for Kurt Hunzeker. Kurt's a member of our board, and Kurt has a heck of a story to tell about the XFL, and I want to say thanks to him and his incredible team for the work that they did to turn the XFL into a true phenomenon in this market, and not to not approach this with the level of seriousness that we need to. But the XFL this week actually listed their top creditors in their bankruptcy filing, and by mistake, the St. Louis Sports Commission was listed as the #1 national creditor of the XFL, and so that's a sort of a moment in time that has brought Kurt and the Sports Commission together, and that's a place where we're glad to be with Kurt. It was not the Sports Commission that is owed all that money by the XFL, and we continue to work with all of our sports teams and events in the region in the hopes that baseball and hockey and MLS and the Ascension Charity Classic Golf and Worldwide Technology Raceway Gateway Motorsports Park will all be back as soon as possible, because sports just mean so much to our region. So I'll leave my comments at that and be happy to take questions on any sports topic going forward.
Frank, thank you very much. Super interesting information. Really appreciate that update. And when you mentioned a swimming event of that scale, I was racking my mind to figure out where it would be. The Dome is the last place I thought. And by the way, I did not grow up wrestling. I'm from University City, and I married someone who is full of just wrestlers on her side of the family. So I found all of the wrestling fans, and they're super serious about their business. I can certainly tell you that. And so last week we had Jim Bullard on from the Federal Reserve, and we talked about the economic impact of COVID-19 on the region. And we also talked to Dr. Satterwhite, and I think it's obvious to everyone that this virus is going to be with us for at least the next year, right? We haven't hit the peak yet in St. Louis. Rumor is that we might soon, but either way, there's going to be an element of this with us. What do you think it's going to take for fans to come back to stadiums, to be comfortable going to games, at every level, at the collegiate level, at the professional level, at the local level?
I think they have to be assured that they're going to be safe, and it's pretty much as simple as that. I'm married to a college athletics commissioner, and I hear all the NCAA council calls and the Missouri Valley Conference calls. Upstairs she gets the sunroom, I get the basement, but those conversations are taking place every day, and you hear what happens if the college football season doesn't start until next January or February in order to make it safer for fans. You're hearing baseball and hockey talk about single site or 1 or 2 or 3 site venues without fans that can accommodate the end of the 2020 season and the baseball season that was supposed to have started next or last month. But the bottom line is fans have to be safe, and fans have to be assured that they'll be safe at games. And I know that all of our teams and leagues and universities are working in the very same direction on that.
Awesome, Frank. And one last question. What's important for our members to know about the sports community? You mentioned a little bit about that at the top, but how are sports playing a role in the community during this crisis?
Well, I think sports are the most visible things, that we have. And so I salute the Cardinals and the Blues for coming together on the Rise Up for Heroes program to salute the frontline workers who are doing so much. I know that the Cardinals are one of 18 teams in Major League Baseball that continue to pay their operations employees to at least through the month of May to make sure that they hold their team intact. I think we're planning for a lot of eventualities. What does the season look like, with fans, without fans? And I think that there's a lot of, sort of pent up anticipation. We've been watching the 2006 and the 2011 World Series, and I could probably sit here and watch the 2019 Stanley Cup over and over and over again. Although I much prefer the 2020 Stanley Cup playoffs. But it's waiting for us. It's our excitement. It's our fun, and we're all going to do what we can to bring it back as soon as possible.
Well, Mr. Viverito, thank you very much for joining us today and everything that you do. We certainly hope to see sports come back to St. Louis in a safe way, so we can get back to the business of what we love to do. Thank you very much.
Thank you.
I'd now like to pass it on to the former president of the St. Louis BattleHawks, Kurt Hunzeker. Kurt led the BattleHawks fan engagement and team operations that included talent acquisition, corporate partnerships, community initiatives, social media channels, and the game day and venue experience. Prior to his role with the XFL, Kurt was the vice president of marketing strategy and research of minor league baseball. Please welcome Kurt Hunzeker.
Good morning, and thank you for having me. And for the record, I absolutely despise the word former in my title now. It just doesn't quite seem to fit still, even though it's been a week and a half since the XFL ceased operations. But it has everything to do with this virus. And I'll kind of dive into really the BattleHawks and what we were able to accomplish here in the St. Louis community, with the St. Louis community, and not just the fan base, but with civic leaders like Frank, with the St. Louis Regional Chamber, with the mayor's office, with everybody. This was truly a collaborative effort, and even though it met a very untimely and quick end, it's an experience I'll never ever forget, and I would still do it again and again and again and again. But let me kind of dive into my screen here. So I'll give you a quick overview. And when I say quick, I have 103 slides, so I'll motor through it pretty quickly. Of course, I'm just kidding, but anybody from the BattleHawks front office that's on the phone, they know that that document does exist. But one thing for us, and we really prided ourselves on, was really embracing the St. Louis community. And the fact, and Bernie said it so well in his article back in February, the fact that not only did we deliver on that goal, but how we delivered it. When I say we, it's not the BattleHawks front office, the 22 of us, or the coaching staff, which is about 25, or the 58 players. It is really the entire community. The BattleHawks were St. Louis's first homegrown pro football team. And we openly asked the community to help us build this brand, create this team, create that dome environment that, for any of you that were able to go to the dome for our 2 magical games in February, you know what that experience was like. It was so loud, it was so awesome. And just being able to really keep the momentum going that the Blues had created for St. Louis from a civic pride through sports, all the way through the end of our season, is something that we will always cherish. That hopefully we brought smiles to people's faces, and when they think back to the BattleHawks and what we were able to do to hopefully and finally dispel the rumor that St. Louis is not a football town, that will be our lasting legacy, and that's something that the COVID-19 virus can't take away. So from day one, we really focused in on what we call the 4 quadrants of St. Louis. And for this audience, it's absolutely perfect. We took a very regional approach, going from east to west, the Metro East in Illinois, St. Louis City, St. Louis County, and the surrounding Missouri counties. We wanted to ensure that we hit this bullseye to build this homegrown pro football team in the St. Louis community. What ended up happening was the outer rings, the ripple effect of this bullseye was definitely felt and definitely quantifiable in ticket sales and merchandise sales. I mean, we had season ticket accounts in 47 states. We had merchandise purchased in 49. Got to have a discussion with people from North Dakota, but it is truly amazing how expats, people from St. Louis who grew up in St. Louis, grew up with either the Gridbirds or the Rams, really wanted to be a part of this, even if they couldn't physically come to any of the games. And that really just shows, again, how awesome this community is, where even if you move away, you're always taking St. Louis with you. So we had 2 official games on February 23rd and the 29th. We set the XFL 2020 attendance record with that first game. And then we had a sellout for game 2 6 days later. And sellout for us from a seating capacity at the Dome, the lower bowl only, was 27,500. So we really shoehorned people into the suites on game 1. Game 2 was pretty much a very comfortable crowd. But based on fan feedback and demand, we absolutely had to open up the top, the terrace, the loge and terrace levels at the Dome for game 3, which would have been on March 21st. So you want to talk about how swift this virus has changed everything, and per this conversation specific to sports, 1 month ago, we should have had at least 45,000, if not 50 to 55,000 plus fans inside the Dome cheering on St. Louis's homegrown BattleHawks. That's how quick this happened. We went from probably having one of the greatest experiences of our professional lives in a really loud and raucous and awesome Dome to being unemployed. And it's amazing how fast that this all happened. Had we been able to get to games 4 and 5, game 4 was going to be our military salute in partnership with our friends at Schnucks, and to benefit Folds of Honor, which the BattleHawks were a great partner of here in the St. Louis community. And then our youth festival, which would have been on Easter, our final home game of the season, a regular season game on Easter. And there we easily could have opened up the top sections again based on demand and given how much the St. Louis community embraced this team. And we took every single cue from the community, whether it was, hey, here's where you should go for your happy hours with Bud Select, or, hey, we'd love to connect with the fans more. Can you bring them out to events? To, hey, open up the top of the Dome. This was St. Louis's team. We were just the stewards that made the things happen, and working with great partners like the St. Louis Sports Commission and with the Dome. I was truly, really, really getting excited at the concept of, hey, in 2021, we're just going to have the top open for all the home games. And that was clearly what we were planning for until this virus came to the forefront and legitimately halted everything. So, Frank had talked about the economic impact and he didn't want to get into the numbers. I kind of have to, as much as it hurts seeing the actuals in the right-hand column versus where we were likely going, just because I need it to tell the full picture of not just the XFL or the BattleHawks, but of what a great football town St. Louis is. So if you look at this, the league assigned KPIs and our attendance goals was still fairly aggressive for a startup of just about 18,850 per game, a little over 94,000 for the season. When the league officially suspended on Thursday, March 12th, we had already sold 130,000 tickets. And there's the breakdown of each of the 5 games. With the trend lines that we had and using data and the resources to determine where we could have gone, even if I take the very conservative outlook of 45,000 for game 3 and just the lower bowl for games 4 and 5, we would have sold more than 157,000 tickets. But coronavirus came into our lives, and extraordinarily quickly, and we never got a chance to play those 3 games. From a monetary standpoint, outside of 22 unbelievable people in the front office and 25 plus people in the football operations side now being unemployed in a very tumultuous time in the sports industry, the economic impact of where we were on March 12th where we were going if we played 5 games and where we ended up is unmistakable. So we would have crushed metrics. Football easily works in St. Louis. The XFL and spring football was working everywhere. And I think the one thing that has really come to the forefront in my mind is that, and believe me, I've been thinking a lot about everything ever since the 10th of April when the league ceased operations, is statistics has always been the backbone of sports. And yet I think the reality is the schedule has always been the backbone. You could plan everything around when sporting events were to occur. And for the XFL, we started the week after the Super Bowl. And when, and for years in advance, the NFL knows when and where the Super Bowl is going to be held. And when the doubt started creeping in of, well, if the NFL waits to start until later in the year, they don't start on time, maybe maybe college football becomes a spring sport. The guarantee that that schedule of we were starting the week after the Super Bowl went from being marked in stone and or Sharpie to a very faint pencil to where we really legitimately, we as the XFL legitimately didn't know when the 2021 season was going to start. I think, and I was not a part of those conversations, but I think that really turned the tide of knowing we were planning and absolutely pushing towards starting the week after the Super Bowl in 2021. We had big plans. They're already in motion. And when you lose the guarantee of sorts of your schedule, and maybe you're not playing in 2021, maybe you have to wait till 2022, then the math becomes wildly different. And regardless of how much revenue we lost in year one because the season gets truncated, if you can't even guarantee a second year, that made for what I can only imagine being incredibly difficult decision-making at the league level. And for a startup league, even though it was working without the historical background, without the reserves, cash reserves to weather this COVID epidemic, it just, the math became really, really tough to sustain. But I'm trying to stay extraordinarily positive. And like I mentioned previously, this was a dream job of a lifetime. And the St. Louis community, both the fans, our civic partners and our commercial partners, as you see on the screen now, really made this an experience of a lifetime. And if any of these logos and any of these brands and these excellent leaders and that we worked with on a day-to-day basis to bring the BattleHawks to St. Louis weren't a part of it, there'd be something really, really missing. And so I will forever love this slide. I will forever love these brands, and really thankful for what they did for the St. Louis community to bring football pride, to bring civic pride, to helping build St. Louis's first homegrown pro football team and bring it to life. I hope we made the St. Louis community proud. I hope we made our partners proud. And I'm hoping that even years from now, when people think of the BattleHawks, they'll think of the good times. Amazing. I want to end with a couple of slides, and again, to show you the speed of how things end. We were so excited to be so welcomed by the St. Louis community, and specifically the sports community, so quickly. The Blues and the Cardinals and the MLS for the Lou ownership group were outstanding from day one. And instead of being the little brother that no one wants to talk to, they embraced us just as quickly as the St. Louis community embraced us. And so a little over a month ago, when the Cardinals sent this out, to be included in this was really a big deal for us, just because we wanted to be a part of St. Louis, and this really felt, it just felt great seeing us a part of the pro football community here in St. Louis. And to now not be a part of that really hurts, really, really hurts. But what hurts the most, and what I'd hope, and what my kind of new job in life is these are the 22 people who took all the incoming requests from the St. Louis community and built this team and delivered the product that St. Louis wanted. And if anybody wants to hire the best and the brightest, for when we all cannonball out of this in the hopefully coming weeks and months. I will do anything in my power to make sure that these 21 other individuals that were part of my family at the BattleHawks land as quickly as possible. Hopefully we represented the St. Louis region well. I hope you guys enjoyed the product that we delivered, and we're all looking forward to being able to do this again in the very near future. I'll take any questions that you guys may have.
Kurt, really appreciate it and completely empathizing with what this has done. I'm not sure if I could speak to why the people in North Dakota didn't buy BattleHawks gear, but I bet that that's going to be a pretty sweet commodity coming up. I got to tell you, in the office, we went from what the heck is a BattleHawk to let's go BattleHawks in just a matter of weeks. It became a thing, and I'm really upset that I missed out. Other folks from the office were able to snag our tickets, but a smile does come across my face when I think about what you guys were able to achieve. You mentioned that from the beginning. When you think about what you guys were able to do and to be on that list of the top major teams in St. Louis. You were certainly on ours, and it's certainly an awesome STL made story. So it seems like there was great support in St. Louis for the team. There obviously was. Do you think the decision to cancel the league was based on, how well the other teams were doing at all?
No, I think it was legitimately the schedule, because all 8 team presidents really on the 13th of March, so it was Friday, we all started working on 2021, because what we didn't have going into this season was really a full off season. I started on July 1st, so I had 7 months and a week until our first game. And we had to hire an entire staff in that time as well. So it was build the foundation, make sure you can open the doors to our venues. The beer is cold and the hot dogs are warm. And, if you can sell some merchandise, super duper. With a full off season and even a little bit more, we were able to do a lot. And here in St. Louis, we were working on a couple of big initiatives. One was building the next generation of football fanatics. And so all of the flag and tackle football teams in St. Louis, I was going to try to rebrand the junior BattleHawks. And then we're actually going to extend that out to that next ripple that I was talking about in Central Illinois, Iowa, Indiana, even Nebraska, and looking to brand, youth teams in Omaha as the junior BattleHawks. And then we're going to get a mascot, so Louie and Fredbird would have a friend. And I mean, there's just a lot of things that we were looking forward to do in 2021, and we were building that plan. And I think as soon as the reality of we don't know when we can start crept into the picture, and that changes just everything regarding a startup. I think that's what absolutely caused what eventually happened of ceasing operations and filing Chapter 11. It has absolutely nothing to do with the fact that the XFL wasn't working. It was a first year 2, year 3, year 4 is when you're going to see some pretty significant growth across the board.
So do you ever see the NFL coming back to St. Louis, or the XFL making its way back ever?
Well, they should. Whether or not that happens, I have no idea. But what we certainly, and what my 103-page recap certainly suggests, if not outright says it through pictures and quantifiable metrics, is that this is a robust football market with robust corporate partners, with a fan base that loves teams that love them. And whether it's the NFL, whether it's a later iteration of a spring football league, what have you, this community would support that team in ways that I never imagined. Candidly, how loud it was during our 2 home games, how people, to your point, went from why BattleHawks to cacaw in almost the same conversation is something that is unexplainable. But unless you're from St. Louis, then it's totally explainable because of what a great sports town it is. And what the BattleHawks clearly demonstrated is really eliminating any kind of false narrative that might be out there that St. Louis can't sustain a professional football team. Even with the MLS team coming, there was plenty of love and civic pride to go around to support everybody.
There was plenty of civic pride. We were hearing caca in the halls of the chamber. That is actually a fact. So one last question. What's next for you and the employees of the BattleHawks?
That's a big question. I wish, going back to the crystal ball from the good doctor earlier, I would love to know what's next, but the sports industry is, and it kind of goes back to the schedule. It's hard to plan. It's hard to reignite hiring that was in progress when you don't know when things are going to ramp back up again. My goal, and one of the reasons why I did finish the recap, was to have to deliver to the staff of the BattleHawks an awesome brag book that they were co-authors of. So when people do start hiring, and candidly, I think this is a time when you can really start to plan. You might not know when the launch date is, but you can get a lot of the things that take so much time. And when you have to be reactive, given our industry, now that you can sit back and understand, oh, okay, now we have a little bit of time, let's focus, let's plan, and then build it and then go when everybody goes. There's some great executives that work with me that would be, I think, instrumental for a lot of brands. And as you know, the president of the team, my goal is to help all 21 of them land as quickly as possible. And obviously, as you guys can see from that awesome title, former team president, I have to land at some point too. And you know what? It's not because anything we did to BattleHawks didn't work. It was really, really working. And whether it's a sports team or really any company, there are so many great executives that were part of this experience that if you're looking to hire in the coming weeks and months, I will do anything for the BattleHawks staff to position them for the next great chapter in their careers.
Well, thank you, Kurt. What a great story that is, and just an unfortunate finish. But I want to thank Catherine and Frank and Kurt for their time this morning. And thank all of you for joining today's COVID-19 briefing on health and sports in the St. Louis region. While our entire region faces uncertain times, we will recover from this pandemic and embark on the road to recovery. I look forward to watching as the Cardinals and the Blues games come in the near future, hopefully. So please join us for another Business Sustainability and Recovery series on employment considerations. The virtual meeting will be held at 10 a.m. this Thursday, April 23rd on Zoom. The webinar will explore how our leaders are navigating the unique issues presented by the pandemic and how to protect their companies and their employees. Please see our website for more details. Thank you again for joining our virtual meeting. The meeting is now adjourned. Thank you.